Hello, we wanted to introduce to you the dual-track fully intermedullary clavicle screw from Acumed, a new device out here on the market. And we've done specific dual-track Sawbones after some experiences with our old Sawbones so that we can improve on the experience. So we want to introduce that to you today. The dual-track intermedullary clavicle screw comes in a convenient platter which includes everything that you'll need for the procedure with the addition of serrated clamps and a 2/8 drill. On the platter you'll notice that the devices come in a range of diameters and sizes. There are two diameters, 3/0 and 3/8. And they range in size from 80 millimeters and go in 10 millimeter increments to 90, 100, 110, 120. This will give you a range of 10 implants to fit all types of clavicle sizes. So talking a bit about the specific Sawbones that we had manufactured, they just feature a transverse midshaft fracture. That's the indication for use of the dual track. And what we've done is we've pre-drilled these just as a canal would be within the clavicle with a 2/8 drill. That way just ensuring that we're hitting that canal with the technique the way that we would want to. So as you approach the clavicle, the first thing that the surgeon will do is make a 3 millimeter incision over the fracture site. That'll be right across Langer's lines. You'll open that up and then with a 2/8 drill in either direction, confirm where that canal is. And make sure under fluoroscopy not to exit the bone. So you'll just drill to confirm where that canal is in both fragments, both medial and lateral. The next step is to use your T-handled reamer. And as mentioned, there's a 3/0 and a 3/8 implant. And using the reamer will be the decision point as to what dual track you'll be finally implanting. Since we're using a Sawbone, and I've done this a couple times, we'll be using a 3/0 implant. The difference is if you're ream with a 3/0 and you don't engage cortical bone, you'll step up to the 3/8. Here, of course, I know in my patient I'm getting good quality bone. And you'll ream from the fracture site again, making sure not to exit the bone. You'll also notice the T-handled reamer has length measurements, and here on the lateral fragment we're getting a measure of 45. You'll want to make note of that length. And then you'll ream the medial fragment, again from the fracture site. And that will again give you a measure. You'll take note of that measurement here. It's 50, and therefore on first indication you'll be using a 3/0 dual track with a 50 plus 45, 95 for length. You'll size down to the 90 implant. There's another point in the technique where you'll confirm that length, so we'll get to that point. But within the first two steps here, you'll have your confirmation of your implant diameter and length. The next device that you use is a tap drill. You'll chuck this up on the blunt end near the threads and let that trocar tip lead you. This device will again come from the fracture site, and I'm going to be coming medial to lateral, and on the final implant I'll be coming with the implant lateral to medial. You'll see that at the end. As we advance that out, a trocar tip here will break the cortices. It'll tent the skin posteriorly. You'll make a slit incision and continue to advance that tap drill out forward until the threads start to engage that lateral fragment. Once those threads are engaged, you'll unchuck, power, and rechuck posteriorly in the section with tri-flat contours. So those tri-flats correspond with a universal driver. You'll chuck that down and reverse the drill until all the threads are engaged in that lateral fragment. Once the threads are all the way across, you'll align your fragments and continue to go forward advancing the tap drill across the fracture site. Under floral, you'll ensure that the tap drill doesn't exit the bone and that you have all the threads across the fracture site. And since I'm in a Sawbones lab here, I get to cheat a little bit and make sure that my threads are all the way across by moving the lateral fragment. So once I know that those are across, I'll unchuck power, and the tap drill will act as a guide wire for the step drill in the next step. So what you'll see here is we have our rubber-handled driver. This is a ratcheting driver, so make sure that that's engaged, and the step drill and the cannula. You'll notice that the step drill has two features here. There's two grooves that will indicate for depth that you're advancing, and that window has laser marks. What you want to do is line up to confirm your length of final device to be implanted when you're to length. And what you're doing with the step drill is you're just drilling to the tail end portion of the dual track. So you're not going all the way across the clavicle. This is a cannulated device. Make sure that this cannula is snug to the bone. And you'll advance until the first groove is even with the end of the cannula, making sure that the cannula is snug to the surface of the bone. When you're to depth, you'll take a look at your window here, and I can see that I am just past the 90 in length on the tap drill. So I'm going to implant a 3/0 diameter, 80 millimeter in length dual track. So once I've reached that first groove, back out the step drill. Under power, I'll back out the tap drill. And with that, I'm ready to implant my device. Unique devices within the dual track system is this insertion tool. This will come right from the fracture site and come out posteriorly. If you think about the soft tissue, liquids, fluids that you have to deal with in the operating room, this is just a nice guide to make sure that the dual track implant is targeted back at the canal that you drilled. We have the implant here, 3/0 by 80 millimeter in length hex driver, and the cannula again. And you notice the hex driver has those 2 grooves as well that you saw in the step drill. As you advance the implant, this will back the insertion tool out. And you'll appreciate that the engineers had the foresight of putting a ratcheting driver in the device. As the implant nears the fracture site, you'll align your fragments, continue to advance. And with that cannula snug to the bone, you'll advance again to the first groove. With that tail portion beginning to engage in the bone, experience a little bit more resistance. It's starting to put some compressive forces on the fracture site. And when you hit that first groove, this is going to indicate to you that you're exerting 3 millimeters in compression on the fracture site, and the implant is going to be flush to the cortical surface. I want to make a note of the grooves on the hex driver and the step drill. In most cases, the surgeon's going to want to maximize 3 millimeters of compression on the fracture site and the implant flush to the cortical surface. In this instance, you want to go with the step drill to the first groove and the hex driver to the first groove. The surgeon also has the option of drilling for reduced compression, and in that instance you'll use the step drill to the second groove and the hex driver to the first, and that will indicate that the implant is flush to the cortical surface and there's reduced compression at the fracture site. The surgeon may also want the option of burying that implant up to 5 millimeters. In that instance, you'll go with the step drill to the second groove and the hex driver to the second groove, and that will exert that 3 millimeter of maximized compression on the fracture site and drive that implant to its buried 5 millimeters under the surface of the bone. So with that, that's the technique for a finished dual track clavicle. A couple of notes, that tips and tricks to want to make sure that you keep in mind that other than the platter, you want to bring in at least a 2/8 drill and the serrated clamps. We always recommend that you bring the dual track in with the universal clavicle plating set, lest you have to use that for a back out option. Keep in mind that the reamer is the decision point as to the diameter, and it also gives you your first indication for length. If you're not engaging cortex with a 3/0 reamer, you'll step up to a 3/8 and follow the technique through there. Most of the time, you'll want to do maximized compression of 3 millimeters on the fracture site and implant flush to the surface, and that's indicated by the step drill with the first groove and the hex driver with the second groove. Always remember to include your cannula when driving both the step drill and the hex driver. That will give you your indication for how deep you are. And a couple notes on this hex driver. It's a 3/0 hex driver. It's a Hudson Connect, which is a little bit unique. We want to make sure that the surgeons are doing this under hand power, and it's ratcheting. So just a couple unique features of the device there. So again, two methods of getting your measurement are with the reamer for length, and then also with that window in the step drill. The features that you want to ensure that you sell on is it's a fully intermedullary implant, which is unique on the market. Everything else has an external means of fixation, whereas we give our compressive forces through the differential pitch on the tip and tail of the implant. It's a minimally invasive technique with a 3 centimeter incision on the over the fracture site, and then a 1 centimeter incision over the posterior end. And there's a technique for both a medial entry approach as well as a lateral entry technique. So that is the dual track fully intermedullary clavicle implant.